Welcome once again to my weekly webcast, and it's your opportunity to ask Chuck questions that are emailed by Twitter, by Facebook, however you might want to communicate to me your questions. I encourage you to do it to make the process of representative government work. I take a couple questions given to me each week, so this week we're going to turn to questions from Gary Danville down in southeast Iowa. Emails, what can be done about our national debt? A short answer, spend less. We shouldn't be increasing spending more than the economic growth of our tax base that supports it. And that economic growth right now is probably very much zero or a little bit less. So we ought to be spending accordingly. Instead, what is the new majority in Congress doing now? They're spending, instead of 3% increases that we had for the first 5 months of this year, as we started this year yet under the Bush administration, immediately when they got in power, they went to a 9% increase. And it looks to me like they're going to have 2010 over 2009 also about an 8 or 9% increase. That's 3 or 4 times what it ought to be, considering the fact that there's less money coming into the federal treasury. Then we had the 787 stimulus bill on top of it, and it might be okay if that bill had done any good, but it doesn't seem to be stimulating the economy. Now some people propose that we ought to increase taxes, but every time taxes have been increased, I think it'll come out that it's a license to spend about $1.15 more than the dollar that comes in. So that's why I always say people are not telling me that they're undertaxed. They always say that we're overspending. And so you got to reduce spending if you're ever going to get the deficit under control. The next question came from, by way of Twitter, Mary at Carson, Iowa, out in western Iowa. We have the question, isn't the penalty for not having insurance the same thing as a tax increase? What she's talking about is the individual mandate. Under the bills in Congress, if you don't have health insurance, like in Iowa you have to have car insurance, you would be penalized. And so a lot of people don't want to buy health insurance. They can't afford to buy health insurance. And if they didn't buy health insurance, a family of 4 would have a $1,900 year penalty, and that penalty is in fact a tax increase. And that's not my saying it. The the Joint Committee on Taxation, professionals in the area of taxation, they say that it's an increase in taxes. Now, I hope you'll continue to email, Twitter, or Facebook me some questions for next week. In the meantime, we're going to be working on the defense appropriation bill. For instance, this very day we will have votes on 14 different amendments on defense appropriation bill. We also have some nominations up today to vote for, because the Senate must approve presidential nominations. And then in the Senate Finance Committee, although most of the debate on amendments are done in the Senate Finance Committee, we're going to have to take about a 2 or 3 day break here until the Congressional Budget Office decides if it doesn't add to the deficit, because even the Democrats on the committee don't want to put out a bill that adds to the deficit. So we're in a situation now for the Congressional Budget Office to make that determination. If that bill comes back from the Congressional Budget Office saying it's deficit neutral, doesn't add to the deficit, I assume it'll be voted out of committee on a straight party line vote. 13 Democrats for it, 10 Republicans against it. So I want to vote against it because I think it doesn't take care of the individual mandate. I don't think we ought to have an individual mandate and the $1,900 penalty that goes with it, which is an increase in taxes for people that don't have health insurance. With that said, I invite you now to my webcast next week. We'll be in session. We were originally thought we were going to have next week off, for the federal holiday of Columbus. I had scheduled several meetings in Iowa that have to be canceled now because Senator Reid wants to keep us in session to rush along this health insurance program that possibly could nationalize health insurance in the United States the same way that General Motors has been nationalized. And I think that's bad for our country.